The technology which I'm going to present today is dissolvable wound healing patches for diabetic foot ulcer. Talking about the diabetic foot ulcers, it is one of the most common complications of the patients who are suffering from diabetes mellitus, whether it is 1 or 2, and is not very well controlled. These wounds, they are the open wounds, which is the main problem that how we are going to heal them. And they develop generally on the feet of the individuals who are suffering from diabetes. They have a very low tendency to get healed, and it even takes years, to get them actually healed properly. This can even lead to serious infections and many other complications. In many of the cases, amputation needs to be done if these wounds they are not treated properly. So, in the treatment of the diabetic foot ulcers, it accounts for almost 1/3 of the total cost of the diabetic care, which is taken into account. And despite these healthcare costs, about 20% of the patients they have unhealed diabetic foot ulcers. Apart from this, the mortality rate is very high, 5% in 1 year and 42%, in 5 years, while the risk is 2.5 times mortality risk at 5 years for the patient who is suffering from with diabetes or even with the DFU. So many of these patients they end up with amputations and they become disabled. So it's greater than 1 million diabetic patients we see, and more than 1 million diabetic amputations are observed annually. They are reported quite commonly in the literature. So when we talk of how they are being addressed today, though we don't have any apt technology to address them, hit and trials are going on with dressings, creams, with antiseptic ointment, because all of these they are being used for dressing purpose. We don't have any actual treatment or a therapeutic regimen to cure the DFU. Other therapies like the hyperbaric excision therapy or the negative pressure wound therapy or bioengineered skin substitute, they are available and antiseptic and antimicrobials. But most of them, they have disadvantages, high cost for the rejection in case of the bioengineered skin substitutes, and they are not quite easily available. So all these, they actually made us effective that we need to really think about a way which can take care of the wound, how the established wound can be taken care. So the problem with this type of wound, specifically the diabetic wound, is the high volume of the exudate microbial infection. The chances of microbial, because it's an open wound, so the chances of getting the microbial infection is much more, and the perfusion is low. These all things they lead to non-compliance to the available therapies. What we have done is we have prepared nanostructured lipid carriers of two of the molecules. One is a nutraceutical, that is white curcumin, also referred to as tetrahydrocurcumin, which is obtained from curcumin as a metabolite. But we have obtained a 95% extract from a company that is Sanath Product Limited. Then we have nano-coated them to use nano-structured lipid carriers. Along with that, a white, that is folic acid, B9 was also added to it. So both the molecules, they were being co-loaded into the lipidic nanostructures, and these lipidic nanostructures were then poured into a dissolvable patch. They were incorporated to form a dissolvable patch using a film forming machine. The beauty of these dissolvable patches is that you do not need to peel it of the other therapies available in the market. If we talk of, we do have dressings available, but these dressings, they need to we need to peel them off basically, and that peeling off is a very painful procedure. So these dissolvable patches, they are going to enhance patient compliance. They are much easy to apply, and this topical treatment is, it's going to have much lower side effect, anticipated side effect. You can see in the toxicity studies, we saw both the molecule once incorporated into the nanostructured lipid carriers, they were quite safe and no toxicity was observed. Much better safety profile than other ones. So for this technology, the patent has been filed and we need to scale up because it's being done at the lab scale and done the preclinical irritation studies, toxicity studies, studies in cell line to prove the efficacy of the combination, to promote the regeneration of the cells, the nerve cells. And so this is the first kind of the dressing which is not going to require any peel off, and because it's a nutraceutical base, it's going to be safe and highly bioavailable because white curcumin per se has a solubility of 56 nanogram per ml, and if incorporated to the nanostructured lipid carrier, it's going to enhance its bioavailability and retention over the time. If we look at the cost benefit analysis here, we can see that the product valuation cost we have calculated for our product is comparatively lower for the batch size of 10 by 10 centimeter as compared to the other ones that was Convaform or the Dura. So as of now, we have, because we have done the POC studies in the animal model of DST, I feel that we need to work out for the scale-up of this product so that it can be brought up till the level of TRL once we scale it up and we do clinical trials.
Ma'am, please conclude.
Talk of the market potential, lately it's going to be a very good product because it can be used for any kind of open wounds, normal wounds, or the accidental, the mouth ulcers even. And if we look into the market scenario, so the global wound care market in terms of revenue was estimated to be US million to 20.8 billion in 2022, and it is expected to reach 27.2 billion by 2027. Looking into this, it seems that if we are going to work for the commercialization of this product, definitely it is going to add value to the treatment of the diabetic foot ulcer. For the purpose of commercialization, I think once we are, we are going to reach the TRL level 9, we can either out-license or transfer the technology. And for the scale-up feasibility, because I've been working with this NLC and lipidic nanoparticles, we do have a company to which we have already transferred a technology. We do have the facility to scale them up till 40,000 liters, and it's not going to be a tough task to scale it up and to formulate into a disposable patch. So we need funding for this so that the product can be brought from TRL4 to TRL9, because for that we would need more of the raw material so that we can bring up from just a lab scale of 100 ml, we can scale up to more, 1,000 or 10,000, test it, and then hook up to the clinical trials before we think of transferring the technology to the industry. So these are the funding requirements which definitely I will need to take the project forth. So this is what I expect from the industry once we are at TRL 9, or it could be a joint research. As of now, we can work together in all the modalities, starting from the scaling up, the characterization, so that can be at par with the industry expectations and the specifications which they have with the product. And partnership formula, definitely, it's going to be as per university.